Okay, well, let's talk about something that, it's important, and we want to make sure we get this information out because ultimately that's our goal here at the TV station, to get you the information that you need. We're talking about a very important luncheon that we want everybody to come out and be a part of. It's the Multicultural Luncheon, and the purpose of it is to educate our community about the importance of end-of-life care, because we have a lot of families that are going through some very difficult transitions when it comes to their loved ones. So joining us today with more is Chief Medical Officer at Nathan Adelson Hospice, Clevis Parker.
I wonder if you're going to say it right. Clevis.
I got Clevis.
I got you, though.
Okay,
yep.
I was close.
You were
didn't
close.
Quite get it.
Absolutely.
And the Community Outreach Manager at Nathan Adelson Hospice, Cassandra Cotton.
Yes,
great to have you back here.
Thank you. Appreciate being here.
Well, a lot of us have gone through this where we have to face some very difficult choices when it comes to our loved ones, and when they're getting to that point in life where we know we're going to have to take some action and deal with some very difficult things. So let's talk a little bit about, just kind of, again, the purpose of the luncheon and what you want people to take away from the experience. Anyone can start.
Okay, I'll start.
Yeah.
For the Nathan Adelson Hospice Annual Multicultural Luncheon was created to bring all facets of the community together to talk about end-of-life care, to have a better understanding of what hospice is, a better understanding of what palliative care is. So just to bring everybody together so that people will leave with a pocket full of information.
And what, I guess, what do you find, Doctor, or what are some of the questions that people have when it comes to, moving into this point in life and having to step up and make those decisions?
Yeah, that's a sticky question, right? A lot of people feel like hospice is, going to kill their loved ones. We know that that's not really true. The diseases are progressing, and that's why people are dying. Hospice is there for comfort and to make sure that people die peacefully and comfortably as possible. There's a lot of literature that supports that when people enroll in palliative care or hospice, they actually live longer and their quality of life is even better. So at the multicultural event, what we're looking for is trying to make sure that people have a clear understanding of what hospice is and the difference between that and palliative, because it's not the same, and also how do each of us deal with end-of-life issues from a cultural perspective.
That's very interesting too, because there are some cultural nuances, right, that sometimes you have to be mindful of, especially if you're trying to connect those particular people with the resources that they need. And I want you to make that distinction, because you're talking about the fact that people may not know the difference between hospice and palliative care, so can you talk about that?
Absolutely. Hospice is really dedicated for those who have a terminal condition. Medicare defines that as someone whose life expectancy is 6 months or less. And when you're enrolled in hospice, you're no longer seeking curative interventions. Doesn't mean you're not seeking aggressive care. The aggressive care you're seeking is comfort.
Got it.
Versus palliative care, which is something that we provide in conjunction with your normal care that you're getting. So we're just an extra layer of support when you talk about palliative care. So we have physicians, we have nurse practitioners, we have the rest of the interdisciplinary team that we usually have in hospice care, providing all that extra support for patients and families as they're going through whatever serious illness they have. You don't have to forego treatment in palliative care versus hospice care, where you say, okay, we know treatment is no longer beneficial, we're just going to focus on comfort.
Very good. Thank you for making that distinction. Well, we're getting ready to wrap. Cassandra, could you tell everybody how they can get information on being a part of this luncheon?
Yes, I would be glad to. You can always call our main number, which is 702-733-0320, or you can visit our website at www.nah.org.
And that's February 27th, and it's at Pallet Station, and we'll put a link on our sister station's website, news3lv.com. Cassandra and Clevis, thank you.
Thank you.
Appreciate the
Thank you for having us.
Absolutely.
We appreciate it.
And stay with us, we'll be right back.
Thank you so much.